Should we continue public health measures or just learn to live with COVID-19?
That's a great question. I'm 100% on the boat of, for me, the pandemic is over. I think what we saw with the vaccine that, it doesn't necessarily stop transmissibility. You can still get it even if you have the vaccine. I got it personally after I had the vaccine. And I think that we did our best. I think 2 years is enough time to open up society, let people live. You see other countries dropping their mandates, and I think that in order to rebuild trust with your population and have people go out there, spring's on the way. People want to see smiling faces and thrive off of each other's energy, and I think that it's really important to go ahead and open things up, let small businesses thrive, and let's move forward with it all. Let's put the pandemic behind us. We did what we could, and let's keep working on that, obviously, but I think it's time, when you look at the residual cost of people, mental health, and jobs that were lost or businesses that failed, I think that residual cost is so huge.
I'm done. I am so ready for this to be over, but I do not think that we should end it prematurely if it means that we are going to be hurting, potentially, people that are less advantaged or with illnesses, things like that. So as much as I want to say yes, end it, let's go, if it's not safe, I don't think it's the right thing to do.
Learn to live with it.
Learn to live with it.
Yeah. At the end of the day, we've been going through this for like 2 years now, and at this point, obviously, COVID is real. Nobody's disregarding that, but I think it's about time that we, actually start putting our lives forward and doing something versus just being shelled off and locked down.
I think we should be educated as to what we should and shouldn't do and expect that maybe we have to make some changes, but I think we have to be aware and be kind to each other in terms of the regulations.
Well, my suspicion is that some prudence is required, such as encouraging people to wear masks, but realistically there's a limit to what can be done. And to start, we've seen the reaction in Ottawa to the measures. I don't think that, I don't have much sympathy for people inconveniencing our population of the whole city, but at the same time, I think measures need to be scaled back so that we can get back to some sort of normality, as long as it's safe, and it does seem to be so at the moment.
Well, I think kind of both, because it's been many years of restrictions, and of course we can't be doing this the whole time, but we have to make decisions based on science, so I think slow and steady is kind of the way things should go.
I think we should continue following public health measures. I know it's difficult, and like I said, it has taken a toll on our mental health for sure. But I think we need to be a little bit patient. I can see the light at the end of the tunnel, and we can just be more patient and kind to each other. That would probably be more helpful.
Honestly, this is an unpopular opinion, but at this point, everybody knows the risk. Everybody knows how at risk they are, or how affected they would get depending on who you are. You know what I mean? At this point, I think maybe you loosen things up a bit because you're an adult. You can make decisions for yourself.
I would like to know where the light at the end of the tunnel is.
Yeah. And at this point, I think the negative effects of being in all these different mandates, workplaces not being able to function properly, we're not able to see our families and friends and get back to norm. I actually think those effects are probably now outweighing the effects of COVID. Mm-hmm. And there's only so much we can do. We've done the vaccines, we've done the masks, we've done the closures. How much more can we be doing? Because if it's not working, we just need to kind of, I don't know. Sounds harsh, but get over it and move on.
That's a tough question. I mean, you look at the businesses around here and stuff, and I don't want to see any of them go into business, right? But it's a balance. So the public health measures we have are decent, like vaccine passports. I mean, they're annoying. You don't want to have them, but making sure that if you do get it, it's the least impact on our healthcare system. That's what's important, right? So some mandates like masks, this is not a problem. Sure, my glasses are fogging up right now. That's what you got to deal with to help protect other people. So I'm okay with that. Lockdowns, I mean, right now we're doing with Omicron, and they keep getting worse. So the more that we get a variant that gets worse, the worse this could get.
If their vaccines work the way they are, the people that need to be protected against it are protected. And everybody else probably has been exposed to COVID and has natural immunity already. So it's time to start living life, get life back into the businesses that have been suffering for 2 years.
Learn to live with it. I understand at first we needed to take certain precautions. Now that the vaccines are out, I mean, a lot of people don't know the vaccines don't help to get COVID-19, to prevent getting it. It's to prevent hospitalization. That was the biggest thing at first, is that if it overwhelms our healthcare system, which we have a fantastic healthcare system, it's not overwhelmed by much. So that was necessary. At this point, we're a little over 2 years in it, I believe, and it just needs to be done. If somebody wants to wear a mask, go for it. If you want to get vaccinated, then great. I'm double vaccinated for the purpose I needed to, because I'm actually a truck driver, so I needed to get it done, but I don't like being forced to do it.
A little bit of both. I think everybody has to decide for themselves what they're comfortable with and go from there.
I think we should just follow the scientists, trust them. They've had our back for our whole lives. I don't think there's anything wrong with following the science.
The bottom line is they need to somehow learn to live with this virus. They need to release people back out to live. I'll hit on mental illness. We're going through, they want to talk about vaccines and they want to talk about lockdowns. They want to talk about this, but no one's hitting on what they're doing to our children. I got 3 children home. They've been locked down. They've been made to come home from school. It just goes on and on and on. Well, how about that sickness? Because when this is all over with, we think we had sickness and death from COVID. You wait and see what happens to the mental aspect. It's got to be bad. You know it.